All right, welcome everybody. We are here. We are season 4, episode 1. It's been a long journey on the Pro Aging podcast, and we have a return guest today, a greatest hits, which I think is the best way to start the year.
Wait a second. I thought this was Call Me Daddy podcast.
That's right. Call me. No.
I'm in the wrong place.
Pro Aging podcast.
Okay. Now I got to shift gears.
That's right, big dog. Okay.
Good to be back.
we got Dr. Jake Deutsch here, who is, in his own quite an expansive and well-known physician. I met him years ago when I was dying of COVID, when he owned the 𝐒𝐞𝐩 urgent care centers. But he is a board-certified emergency room medical doctor. He's worked at Beth Israel, Mount Sinai. So this guy knows a little bit about everything. But the evolution of his career has been quite interesting, and now functioning and director of Oakwood Precision Medicine, actually partnering with 𝐒𝟒 𝐄𝐲. He is our go-to longevity expert. And we are talking about one hot topic today. Ready, kids? Peptides. You know what that is? Everybody hear what peptides are? It is a great way to start the year. He's been on the show before. He's back. Thank you for coming on. This is going to be the most edited, probably, because it's going to be a 3-hour podcast if we don't keep it simple.
Yes.
So let's get to it. I know. Let's go through the normal housekeeping. Let's first talk about what is a peptide.
I think that's probably the most important thing.
That's the most important thing.
Everybody's interested. People come to see me. Yeah. Hey, my buddy's on peptides. I want to do peptides. I say, so what are they?
Yeah.
What do you want to do? Oh, I don't know, but I just heard about these. Yeah. So the reason why these are so hot, and it's because it's cutting edge, right? What peptide therapy does is what typical medical therapies don't.
Right.
And these compounds are, to break it down, small chain amino acids. Right. And they're held together by a particular type of bond called a peptide bond. So any protein that fits into this size category is what we define as a peptide.
Yeah.
And more importantly, it's like what peptides do. Peptides enhance our body's normal action.
They signal.
They're like a signal.
They tell your body to do what you would normally want it to do better.
Exactly.
Yeah.
But what's really unique about peptides is they're mostly what our body naturally makes.
Yeah.
And they have this modulation activity. So they turn things on, but not if you don't need it.
Right.
And that's what's really unique. When we take medications, they usually have one purpose and a lot of side effects.
Right.
Peptides have many different functions and very little side effect profile for the most part. So this is what's exciting and what's changing the landscape, particularly in health optimization, anti-aging, because we're using them quite a bit in a way that is changing the process.
But I think one of the misconceptions, because they're amino acids, they're found naturally in the body, they're made naturally in the body, they're inducing potentially major changes in your immune system, your hormone system, and people think that they could be totally benign and no big deal.
Right. And that's one of the issues is there's regulatory problems in terms of this not really being highly regulated, and safety issues related to that. Right. Now, they are safe in the sense that what your body makes, but our body also makes powerful steroids and hormones that when taken
exogenous,
inappropriately can be very, very dangerous.
Yeah.
So they are powerful and, in the wrong hands can be quite serious.
And often not tested because they're coming from different compound pharmacy, often labeled research purpose only.
Yes.
Right?
Very big factor. Most people are getting these by just going on the internet and ordering something.
There are some that have been FDA approved, are FDA approved. There are some peptides that have been thoroughly researched and others that have not, right?
Of course.
Like, what are the most common ones right now?
GLP-1.
That's it.
That is a peptide.
Ozempic, Mounjaro. By the way, insulin's a peptide.
Yeah.
Right?
So this is where people really get confused because some peptides act like hormones.
Yeah.
Some hormones are actually peptides. Right. They are not the same.
Yeah.
Hormones work usually in a downstream, like far away from the organs that release them, and peptides are more local. But there's a very important complexity here that if you think you're going to ChatGPT and get the best results here, you are doing yourself a disservice. And that's the most important message here. Right. These are powerful medications with huge potential, but we need to be very cautious as we approach this and make sure that we have good medical guidance.
Let's first talk about the GLP-1s, because I think they're like the kind of OG of really just making it part of the social vernacular, right?
Well, they exploded because they were highly effective.
Yeah.
And
they've been around since like 2000.
Yeah, semaglutide, which is Ozempic, has been around 25, 30 years. What happened is the pharmaceutical companies saw this powerful effect, partly for diabetes therapy and then now for weight loss. And they said, I want to get on the action. And so that's where this has really exploded, because we saw peptide, which was highly effective, now being regulated. And we saw something that's really important to people, weight loss as being the primary benefit.
Not side effect free, though. The GLPs have a nice list of side effects. We don't have to go into all of them, but just shows that these type of peptides can be problematic, right?
They could be problematic in the sense that you could get things like pancreatitis, you could have allergies to this, but more importantly, you could actually lose the wrong kind of weight.
That's right.
Which is what we're really trying to avoid. And under medical supervision is the best way to approach this. I mean, I see people that are getting peptides from, internet with no doctor's visit. They have their dentist prescribing it, perhaps. They're getting it from their trainer in their gym. I mean, all sorts of crazy stories here. And when we're talking about body composition, which is really what it comes down to when we're using GLP-1s, we're trying to lose weight, but we want to improve body composition. Muscle mass is key.
That's right.
So if you are taking a GLP-1 and you don't know where it's coming from, it's not, safely being procured, and you're not having somebody supervise your weight loss and your body composition, you are really setting yourself up for the failure. And that's the Ozempic face and all of the weight loss that we
that's exactly what I was going to say, because it's collagen. One of the biggest protein in your body is like collagen. So the skin thins, you lose volume in the face. But I think the biggest misconception, it's a conversation ever since 2022 when I kind of mentioned the word Ozempic face for the New York Times, that people think it's the drug that causes it. It is not. If you lost 100 pounds, 50 pounds over, you're losing 5 pounds a week very rapidly, it's more to do with the speed of weight loss than the actual drug itself.
And maintaining your muscle mass by eating enough protein and lifting weights.
But when you're older, it is tougher to maintain muscle mass. We can do it. I mean, we're doing it. But
it's essential. It's essential. And I look at muscle mass as currency for longevity. So the more muscle mass you have, the longer you're going to live. But the story about GLP-1s, I think, is even more complex than that, because we now understand how they're working on other parts of our body and being part of our healthcare wellness. So I look at GLP-1s as a foundational peptide. Why? Because they regulate our metabolism. So this weight loss is because our metabolism changes. But if we understand our metabolism is key to every process that's happening in our body.
Particularly aging, sugar metabolism. It's like there have been books written about how sugar is like what's causing aging, not just aesthetic, but biological cellular aging.
Absolutely.
So having an FDA-approved drug like GLP-1, I usually tell people, if you're interested in peptides, let's at least discuss the GLP-1, which is FDA-approved, been around for decades, right?
And you're getting all of these other benefits besides the weight loss. So this metabolic function, that is key. So when I use GLP-1, sometimes people don't really need to lose weight, but I want to start modulating their metabolism. I want to reduce the inflammation. I want to improve their insulin sensitivity. And that's part of the process that helps their metabolism improve. And then everything else that we're working on improves as well. Cholesterol goes down. They have more energy. They start sleeping better.
Joint issues, puffiness in the face, people notice their skin's better,
Food
acne's
noise,
better,
alcohol. So
skin diseases, nothing, food and other things, stress don't cause skin diseases. But if you have psoriasis, if you have eczema, if you have other skin maladies, it's exacerbated. It's exacerbated by what you eat, your stress.
And it all goes back to our metabolism.
Exactly.
And so that's where I think we have to change the conversation about GLP-1s, because people are still saying, well, you don't need to lose weight.
I know. People don't understand that.
And they're saying, like, that's really for people who are diabetic. And sometimes we find medications that are intended for one thing, and they end up ultimately being used for something very different.
Most of the time, it's serendipitous, right? We learned about minoxidil for hair growth through a failed blood pressure pill. Finasteride for prostate.
The list goes on and on.
On and on.
So we just need to, but it's so triggering because the whole concept was this was available for certain people and not for others.
Yeah.
And luckily, we're seeing that landscape shift tremendously.
Yeah.
And I think that that's a good thing. And now people would really need to understand what's happening in terms of the physiology and not it's just for.
And that's where we then words like microdosing, which this is a term which is a little bit nonsensical.
I'm not going to brag. I feel like I was the first person to talk about microdosing GLP-1s.
Okay.
Because really the concept is you don't need a lot.
Yeah.
And when I prescribe it, and anybody who's being, I think, cautious about this and being responsible, the lowest possible dose to get the most maximum.
For anything.
Yes.
Right?
But this one in particular,
Yeah.
if you're just going up on the dose, you're not doing something right.
No.
You're not doing the exercise. You're not working on the diet part. There's, just accountability that also has to play into this. And so I think that concept of keeping it low and working on the other parts are really important.
And I don't know any physician in any specialty who has not discovered an application. As I had mentioned on the gram before and to you, I use it for my post-liposuction patients, not for weight loss, because I don't do liposuction on people who need to lose significant weight.
Yeah.
But it makes their recovery quicker. It helps them with contour maintenance and metabolic function. I've used it myself for chronic shoulder issues, which I no longer have.
Yeah.
And a lot of people who they'll say that their acne from their PCOS is better.
Yeah.
Their eczema is better.
Yeah.
All these types of things.
Yeah. So, I look at GLP-1s as a foundation of peptide therapy, and there's hundreds of peptides out there. When we start to take a look at the list, it's exponential. And again, people need to understand you want to go about this in a way that's safe. So you don't need to be taking 10, these stacks that are, 5 or 6 at a time, people mixing them all together. Oh, yeah. This is not safe. We need to understand that these are powerful medications. There's interactions with one another, and using them under medical supervision is absolutely.
Let's get a little into this now and start talking about some other peptides. First and foremost, route of administration is very important with all medications, right? There are oral GLP-1s. There are some other peptides like BPC 157. You can because it's found naturally in the gut.
Yeah.
But there's a lot of hocus pocus out there. Injection is the main route for most of these medications.
Injection or topical. So for like some of the derm stuff, topical is great.
Yeah.
I use some troches, which is basically like a lozenge that dissolves under your tongue, and that's a great alternative for the injections. But not all pharmacies will make that preparation.
I know that for the growth hormone secretagogues that exists too.
Yes,
Also,
it's a great alternative.
Intranasal.
A little bit of intranasal for stuff like 𝐒𝟒 and NAD type of therapies. But the approach to how you administer is absolutely crucial, because sometimes there's going to be degradation of it if we swallow it.
pH issues, things like that. I think what you were getting to before, Dr. Deutsch was saying how, some people, they get sold like these like a doctor will name like a warrior stack or a this stack or a glow stack, and they'll sell like 5 or 6 peptides. First of all, you would never take 5 different pharmaceutical medicines at one time. If you have a cholesterol issue, right, you're not going to start 4 different medications. You start one at a time. That's judicious medicine.
Yeah.
And you're also not
see
going
if it works, and then you adjust,
and then you
make sure you tolerate it.
And then people putting them all, it's like putting everything in the same pill. Some you have to take with food, some you don't. And the same thing with peptides. They're putting everything in one kind of syringe because they often need to be refrigerated.
Yeah.
It could be a compliance issue. So making it easy by putting them all together isn't necessarily a good thing.
No, and it's expensive. If you're investing in peptide therapy, you could be spending hundreds of dollars a month.
Yeah.
You have to be committed to timing, because that's important. Certain medications you need to take at certain times during the day, and you need to be able to refrigerate it and be prepared to travel with it. So there's a real commitment to it. But going back to your point about having a stack of them, if you want to work on building muscle and body composition, why don't you make sure one therapy is working then add something else before just going 5 in? Yeah. So there's, I think just bad science when you start administering that way. Then we don't know really if there's a side effect, which one caused it.
Exactly. Or which one's working.
Right. So that's important to be able to prevent harm.
Let's talk about the definition, because again, I'm using all these things that people are seeing on Instagram.
Right.
Tell them, what is stacking?
So stacking just means taking them together.
Okay.
So using them in a synergistic way.
Right.
So
that doesn't mean in the same syringe always.
No, definitely not. Because one of the things that we don't know about peptides and interactions with them is certain ones mixed together can cause problems. Sometimes you'll see crystallization. So you actually can have molecules form crystals, which could be harmful if injected.
Wow.
So things like that, that's typical for any medication.
Yeah,
Just because a medication can be given IV and another one can be given IV, you can't put them in the same IV bag.
No.
That is like nursing 101.
Yeah.
Now everybody's acting like they're a nurse. Yeah. That doesn't make sense. But there are certain ones which we do know are synergistic.
Yeah.
Just like a GLP-1 is a foundational peptide, it can be used with many other peptides because it enhances the other's effect. TB4, thymosin, peptides, and BPC, they work great together because they help in healing and regeneration. So those are two that I oftentimes will combine therapies, especially when I know they have an acute injury and there's a target that we're trying to improve. But just taking a bunch in order to have a big stack and be impressive is not at all the thing.
Now, tell me what, we're going to get to monitoring because, again, I think the key thing we're learning right here is that if you're interested in peptides, there's enormous promise, but it takes an expert oversight to do it. So we're going to talk about monitoring and body composition, but tell me about how people are cycling them. Can you take some 365 days a year? Are there others you just do for 8 weeks, 12 weeks? Talk about that a little bit.
Yeah, so there are particular protocols that are important because it relates to how they're functioning and the potential harm.
Yeah.
So there are certain peptides like BPC, another kind of foundational peptide in my opinion. This could be taken almost every day. Do you need to take it every day? Not necessarily.
Yeah.
Can you take it more when you have an acute injury? Absolutely. Should you be monitoring what's happening in your body at the same time? 100%. But then other peptides, especially ones that are helping enhance our growth hormone production, we want to be careful about taking them for too long a period of time because we might have a negative effect. Yeah, you get this down regulation of our receptors and then you get less output. And doing that in combination with evaluation with blood work. There's certain blood tests that we should be monitoring as we're administering these therapies and making sure that there's not issues that are, related to kidney issues, any liver issues, and certainly seeing like if we're stimulating growth hormone, what happens with that the marker that we look at, the IGF-1.
Yeah. And what kind of how often do you recommend doing body composition if you're on peptides?
So, for me, I do body compositions every time I see patients.
I do it once a week myself. No, I'm kidding.
It's like, I like people to do it every month.
Yeah. Really?
I practice precision medicine. So what does that mean? We are being precise about what happens to our body and making adjustments. That's essentially what biohacking is. We change our behavior to change our biology. And part of that is having data. So when we do a body composition analysis, if I'm working on building muscle, I can see your muscle mass went up. If we're working on losing weight, we could see your fat mass went down. We can measure points of circumference. This all plays into where we are adjusting people's therapies.
Yeah.
Sometimes people are just looking at the scale. They're using, for instance, a GLP-1. They lost weight. They're very excited.
Yeah.
They lost all muscle mass. So we need to use that other technology, just the same way as we're monitoring your blood work.
Yeah.
We need to have other parameters to be able to take a look at what peptides are, how they're performing for those goals.
Yeah.
That's why I love wearable devices because it's like a mini scan, in between.
Like the Aura ring you're talking about. Yeah.
Or Whoop, having something that's taking a look at what's your resting heart rate, what's your HRV doing, what is your recovery time looking like? Are those things improving as you're taking 5 or 6 peptides? Yeah. That's a good indication. But if we're seeing things that are not really adding up to positive benefit, now I'm going to readjust that therapy.
Yeah. The VO2 max also very important, say longevity, and it's not something you can easily do in office, but there are a lot of great places that we work with and things like that that I think is a great indicator to detect your cardiovascular health.
Shout out to do more cardio. That's like
exactly.
And let's just for 1 second talk about like foundation. Like peptides are a great option. They are an addition to the foundation.
Exactly.
And the foundation is diet, exercise, and sleep. Yeah. And then all the other stuff that we sprinkle on, optimizing your hormones, bringing in peptides, doing, looking at our parameters from our tests and our metrics, and then working on improving them. That's all icing on the cake.
Yeah.
But if you skip over the foundation, like I see people, they're like, oh, I want to be on peptides. And I'm like, well, you don't do any cardio.
Yeah.
What's the point here? You're really missing the big picture. Yeah. Or your vitamin D is in the toilet.
Yeah.
So
take care of yourself.
But you're willing to, buy a peptide that's from an internet source that's for research purposes, we really have to kind of reset that. What are the basics? And then think about adding those things.
Yeah. I mean, I've had this conversation in the aesthetic world because, I always say, the Botox, the fillers, the laser, a lot of them are putting a Band-Aid on a problem. I'm like, you can only put so much lipstick on a pig, so to speak. You have to take care of yourself. And by the way,
it's a good physician to give you that guidance.
Yeah, this is what the pro-aging lifestyle is all about. Believe it or not, the better you are on the inside, the more aesthetically beautiful you'll be on the outside. I always say, I want to be the icing on the cake. I'm not the meat in the pie.
Yeah.
Peptides are finally helping people on the meat of the pie because it's not so easy to just say lose weight, to just exercise more.
No.
It's empowering people,
Absolutely.
but they have to do it. And my concern is there are two populations that I'm most concerned of with the peptides. Number one, very young people like 20s and 30s who are just trying to juice their engines when they're so young and they don't even need it.
Yes.
Number two, people older, like old people like you and me, who want to use these things to feel and look better, thinking that they could still drink tequila like they were 30, smoke, not exercise, and all these things. And again, as you said, it not only won't work, but what you're doing is just going to blow the wheels off the antique car.
Yeah, exactly. You got to put some maintenance into it.
Yeah.
You have to pamper it. You got to give it a little extra love.
It's a responsibility to start taking these peptides because it's a commitment to take care of you. It's to enable you to take care of yourself in a way that you were never able to do before.
Right.
I think. And there's a lot of research still left to do, right? People just like throwing these darts at the wall.
Well, I think that's a great point that you make. And, people are not okay with taking an experimental drug. I said, listen, we have an experimental drug, to help grow your hair, but we don't know if it's going to cause cancer. You would say, no, thank you.
Yeah,
right. So peptides, you got to think about it the same way, especially when we're talking about the powerful endocrine, interactions.
Yeah.
Our endocrine system is one of the most complicated parts of our, our bodies. And so, underestimating how powerful these are and what it could do. I think that, like you'd mentioned offline, we potentially could have in 30 years a whole population that has significant issues related to abuse of peptides and misuse of peptides and not having correct medical supervision.
There's always going to be that. When Botox and filler came out, it was going to be replace the facelift, and we know what happened with all this stuff. It still doesn't mean that they don't have enormous value in use, but we're learning that the abuse of them is not good. And it's just society has a way of perversing almost everything that's given to them as an option. Yeah. And that's what I fear about these things because it's the Wild West. Let's talk a little bit about hormone replacement therapy. A little bit out of both of our leagues. We defer to the expertise. But, there have, I think, some of the reevaluation of the data of hormone replacement therapy for women has opened up this perception of, there's an axis of manipulation, our endocrine system, that needs to be paid attention to.
Yeah, but first of all, I replace people's hormones in my practice all the time. But when we start talking about women's health, probably one of the biggest advancements that we've seen in the last year is that the regulation and black box warnings came off estrogen as a therapy. And that's because we had some studies that were not really the best.
Weren't interpreted the same way.
Yeah, there was misinterpretation. And, essentially for many years, women were told if you take estrogen, you're going to get breast cancer.
Yeah.
And a lot of it had to do with synthetic versus bioidenticals. And so now the consensus is when monitored, it is highly effective, especially for reducing cardiovascular risk, improving bone density, and just improving sense of wellness. And for women who are going through menopause, a lot of weight issues are related to losing hormones, so optimizing there. And then we see, obviously, improvement in quality of life, libido, mental health, all time.
And there are peptides for this too, to help supplement.
Exactly. But we have to understand that hormone replacement is different than peptide therapy.
Absolutely.
Right. And so while some peptides are hormones, when we give estrogens, it is not a peptide. But as it's important for people to embrace this as a modality, it's also important to them then not to take it lightly. Just because the black box warning has come off doesn't mean that we should be getting it from your trainer or, going to Mexico and buying estrogen creams and not having it.
Or 100% of patients requiring it. I think, because it's commoditization of everything. And I think a lot of women, there are people that are not candidates for estrogen replacement.
Absolutely.
There are women that don't need it.
Yep.
Again, everything is a cost-benefit ratio, and people respond.
And that's the biggest change in the guidelines.
Yeah.
You personalize supervision.
Yeah.
Not everybody, it's on a one-size-fits-all program. And that goes back to, male hormone replacement.
Yeah.
Same deal. Individualized therapy and being monitored.
Yeah.
That is the key. Like, we need to set standards that people are going to have a certain protocol to monitor that in order to mitigate the potential risk there.
That's right.
And that also ties into peptide therapies. I mean, you basically have nobody regulating how people can get this.
Yeah.
And then it's important to establish so people understand the reason why you go to a pharmacy to get your antibiotic is because there's an issue if there's not this 3-part relationship between the doctor, the patient, and the pharmacy. Yeah. And the reason why is that is what's controlling everything. It keeps it balanced. It prevents things like error. It helps regulate and create safety. And that is a very intentional setup. We don't have that with peptides as of yet.
That's true.
So do we want it to be overregulated? Probably not.
Yeah.
There is something about this momentum that is making it more accessible, but we got to have some sort of official process that is going to eliminate the high level of risk that's also associated there.
Let's talk a little bit about, there are so many. I mean, I can, it's dizzying the amount of peptides that are out there.
Right.
I think we could agree that there are some greatest hits. I mean, we talked about GLP-1 being the foundation, but let's talk about some of the other acronyms and numbers and letters that we've heard of as just some
I
of
still
the...
have to look them up, just for the record. I mean, there's certain ones that are so new. I'm like, I gotta
But let's talk about some of like maybe like the top 5 that you find the safety and efficacy profile meets the criteria of considering for your patients.
Sure. I mean, we talked about GLP-1s, and when it comes to those of the FDA approved, tirzepatide, which is Mounjaro, and Zepbound, that is my preferred.
Yeah.
There's obviously a new 3rd generation GLP that's got 3 forms of mechanism. Retatrutide. And not yet FDA approved, but looks very promising, and hopefully...
Don't dabble in it yet, is the summary, right?
Yeah, I mean, my clients are like, oh, my buddy's on it, should I be doing it? And I said, listen, if you want to be, experimental, that's you.
We have 2 great products that are out already.
Right. And really what we're doing is we're monitoring the biggest potential side effects. So GLP-1s, absolutely greatest hits. BPC we talked about. So BPC is body protection compound. It's actually a naturally occurring peptide that's made in our stomach and has a very good amount of effect for our digestive system, but also for inflammation and regeneration. So injuries, inflammation in general, this is my go-to peptide. So almost invariably, if I'm going to start somebody on a peptide regimen, that's going to be one of them.
Would you put someone that doesn't have any obvious, I mean, everyone's got some aches and pains, but I see that there are a lot of people on BPC who are just like, they don't have specific injuries.
It depends. Some people are like, I just want to be using some peptides. So that's a very safe one. And I will give that to them.
Yeah, they do.
Because there's no harm there. It's what our stomach naturally produces. But the one thing I could tell you about BPC is I've had people who've had shoulder injuries, been through physical therapy, considering getting surgery. And we started them on that and it gets better. So
I've had patients recover from facelift surgery, spine surgery, speeding it up. Some plastic surgeons are getting into this.
Yeah, there is real evidence, not only in the literature, but actual in clinical practice that I've seen that happen. And BPC can be oral or
which is
injection.
huge.
So the oral option is a great sort of entry level for people who are afraid of taking injections or maybe don't have as significant of an injury. But I can tell you, when I have somebody who's got like a, meniscus tear, I'm going to recommend that they use the injection. So that's part of the, specifics of that.
Do you put the growth hormone secretagogue peptides in the greatest hits?
Absolutely. So when we are working on overall wellness, one of the keys that we want to address is building lean muscle, working on body composition, helping people lose weight. When we have more growth hormone, what our body naturally makes to make us have stature, when we're adolescents, we put out a lot of growth hormone to grow. As adults, growth hormone helps us look youthful. So hair, skin, staying trim, building muscle, recovering faster. We have more growth hormone.
Inflammation, joint tendons, all this.
Right. And now some people have actually prescribed growth hormone, and there is significant downside from taking that. Our body makes growth hormone in very small little amounts when we're asleep. So if you take a big injection of growth hormone, and it's not big, but it's big to what your body's used to, then your body says, I don't need to make any more, stop making it, and then you have some negative side effects there. Additionally, when people take large doses, they start growing where they don't need to be growing. Skulls get bigger, cartilage grows.
Risk of cancer.
And then risk of things like cancer is presumed to be much higher. So if we can enhance our body's natural production of growth hormone, make a little bit more, but in a way that is very slow and more like what it naturally does, that's where peptides come in. So we have a category that are growth hormone secretagogues that basically signal our body, let's make a little bit more growth hormone.
Yeah.
And that includes semirelin, tesamorelin, CJC, ipamorelin are kind of the three there.
Some of which have been FDA approved at one time.
Yeah, so semirelin was actually used for people with lipodystrophy, which is, in the AIDS crisis, people had a lot of belly fat by taking those medications.
Tesamorelin too?
And tesamorelin, I believe, actually was. So these actually had clinical indications. Now, why they didn't become FDA approved medications, maybe there wasn't enough money in it, right? But now we're starting to see that people benefit by getting more growth hormone using these, and that helps with,
And we can monitor the therapeutic window so they're not getting large amounts that would potentially put you at risk, hypothetically.
Yeah, exactly. So we can measure a blood test called the IGF-1, which can see, all right, you're not optimal. We can enhance that, but we don't need to go higher than that. And so these are really helpful in terms of like an anti-aging protocol.
Yeah.
And I like to think of like semirelin as kind of like step one, tesamorelin step two, and then ipamorelin kind of the third.
Oh, really? You think that ipamorelin is the strongest of them?
Yeah. And you have to know what the correct dosing is with them. And, there's caveats. I've seen people that had allergic reaction to one. Sometimes it's more localized. It's not a systemic reaction. Can they continue to take that? I've worked through that with people. Other times they're actually allergic to one, but they can tolerate another one. So having that experience and knowledge and directing people with this very important thing, potential, life-threatening allergies, this is what we're talking about.
This is the art of medicine. Yeah. It's the art of medicine.
Yeah.
Okay.
So those are pretty important and pretty popular.
Immune system.
Yeah, all of the thymosin peptides, so TB4 or thymosin alpha 4, TB500, very similar. Those are going to help with immune modulation, also work on some inflammation in our body and blood vessel growth, which what we call angiogenesis. So those are pretty big ones.
Everyone is crazy about the fear prevention of dementia.
Yes.
Do you feel that there's really any, they've tried to do it with the GLP-1s. There were some studies that failed, trials that they stopped.
Yeah. So there's not really a peptide for dementia.
Or for preventative or things like that. I mean, that's what everybody wants.
So I look at NAD as my go-to for cognitive function, but it's not a peptide. Right. NAD is a coenzyme our body uses to make ATP. Yeah. So it is injected. Some people get IVs. For a lot of my clients, I'm having them do home injections. So people kind of think of it in that peptide range.
Yeah.
And that is really great for improving energy, mental focus. Does it have any, proven effect to reduce your risk for dementia? No.
We don't know this.
We don't know.
There's a lot of nonsense on the internet about this will prevent dementia, this does that. There's a lot of just things being thrown around. It's important for people to realize.
Right. And, it's like organic.
You know what's great for dementia, preventing dementia? Staying healthy.
Yeah.
Staying fit, getting sleep, reducing stress, not smoking,
right.
monitoring alcohol. I mean, these are the things we know.
And working on cognitive function, like staying active, reading.
Challenging yourself.
Being, not kind of turning off. And for my practice, this is not necessarily related, but I really focus a lot on B12 levels because B12 has been shown in clinical research that higher levels reduce risk of dementia. Oh. So keeping levels above 900 is our therapeutic range for an optimal level. So focusing on that for cognitive health. And then, reducing some of the excessive use of antihistamines like diphenhydramine and Benadryl.
for things for cognitive stuff. What about non-sedating antihistamines like
Totally
Claritin?
fine. Yeah.
Totally fine.
Yeah,
They don't
those-
cause the blood-brain barrier.
Those are not going to be affecting,
Yeah.
kind of the brain health in that capacity.
Yeah. I want to mention 𝐏𝐞𝐩𝐭𝐢𝐝 copper, which is a very emerging and popular, difficult to get peptide. It does apply to aesthetic medicine.
Yeah.
There's quite a bit of research, human research, suggests its efficacy for thickening the skin, anti-aging, wound healing topically.
Yeah.
There's an enormous amount of data out there. We compound it. I have a pharmacy compounded for my patients. I use it myself. I think it's a great future. It's not sun sensitizing like retinoids. It's very tolerable, totally benign. People are really extrapolating this efficacy without any human trials on injectable 𝐏𝐞𝐩𝐭.
So the good thing about injectable 𝐏HCU is it's really not available from any reputable source. So,
Reputable. That doesn't mean it's not available.
you could get it from experimental and other pharmacies that are not approved compounding pharmacies.
Yeah.
But 𝐏HCU, as you said, is kind of the hero skin peptide.
Yeah.
It is going to help with collagen, elastin, that thickness of the skin. So it's something that people who are really worried about skin
Hair growth,
consider.
topically, I use it as an adjunct to minoxidil and finasteride topically.
Yeah.
It does help.
I use it orally as a troche. So,
Oh, really?
Yeah, there's a troche application, which I find to be quite good. Because a lot of my clients, for sensitivity, don't like putting anything on their face that they haven't used before.
Yeah.
If I'm like, well,
And
try
just anecdotally, do you find patients see a difference?
I think they do, but it takes a while.
Yeah. And it's a benign enough thing to do. It's a very tolerant medication.
Yeah.
But again, I'm just always wary about people just like, oh, if a topical works, let's just start injecting it into ourselves.
Right, that's better.
I can think of a lot of topical things that I wouldn't want to inject in myself.
That's a
You know
very
what
good
I'm
point.
saying?
So, 𝐏HCU, definitely skin. Like other things I think about skin, glutathione, not necessarily a peptide, but something that we use to help improve skin.
But these are things you'd have to take regularly as injection at home, right? Because if you just get it like once a month, like an NAD drip in your office, you may not have the same efficacy.
Right.
But, we are developing a culture now that may be a lot more used to doing home injection. I mean, if I tell you the number of women when I counsel them for GLP-1s after lipo and all these things, a lot of the women, I talk to them as if they're going to be fearful of giving themselves an injection. And they're like, honey, I did 10 rounds of in vitro or all these things. Now people are getting used to the fact that they're injecting themselves. So the next generation, it may not be that big deal, or we'll have medications that we can.
Yeah, absolutely. Yeah, the injection thing can be basically a non-starter for
a lot of
many
people.
Yeah.
Yeah.
Other skin peptides like matrixin.
Yeah.
One that
Tell me
helps.
about that.
It's like a collagen. It mimics collagen breakdown.
Yeah.
So basically, that makes your body make some more collagen because your body senses that there's some collagen breakdown. So that's an interesting concept. The other one, it's kind of interesting for you, is arginine.
Yeah.
Because it's supposed to mimic Botox, right? Do I think that somebody should be taking arginine versus getting a neuromodulator?
Yeah.
Absolutely not. Yeah. But listen, if you don't have access to it and you have a safe way to get that, that's something to consider.
But what people have to think about with the skin, it's like with everything else with the health. Like if you're baking in the sun, if you're drinking a lot of alcohol, none of these things, you know what does all the things that these peptides do? Resurfacing with a Fraxel.
Yeah.
Old chemical peels used to do that. The skin is an amazing organ because it turns over every 30 days.
Right.
So regenerative capacity is there.
Yeah.
It's already built into your system.
Just what are you doing to hurt it?
Yeah.
Right. And so this goes back to that same conversation. Having good advice is key. Yeah. Because you might be thinking peptides, because you're scrolling, and you're really missing the right direction here.
Yeah.
And so having somebody say, wait, why aren't you just getting Fraxel? Or why aren't you just,
why don't you stop laying in the sun?
Right. Like, why are you not like taking, using sunscreen or, drinking more water? Like, these are very basic things.
People like taking new things, and if they think they're benign.
But the crazy part is I've heard my entire medical career, people say, oh, I don't take any medications. And they're so happy about it. You know what I mean? I'm like, oh, like your back is hurting you. Oh, I don't like to take anything. And I'm like, now everybody wants to be on 100 things.
Well, because it's not medicating, it's biohacking.
Yeah.
It's putting in people's minds the false power that they can control their longevity forever.
Yeah.
And I think I think we could agree we're here because we think there's an enormous amount of promise to live well, to live long, to look great. It's there.
Yeah.
But unfortunately, without real educated people and guidance,
and educated doctors.
Yeah, that's right.
So here's a point that I think somebody mentioned. I couldn't stop thinking about it. All doctors of the future are going to be longevity doctors. Right?
It's like every derm is a cosmetic dermatologist.
Right.
Every surgeon's a plastic surgeon.
Because this hasn't been what we've been trained.
I know.
And so now, instead of being reactive, all doctors are thinking more proactive, and kind of being a longevity specialist is going to be like, wait, I don't even understand what that means, right? In the next 20 years. But that's the construct. And, to some degree, this is very good that people are interested, they're engaged, they want to try to improve themselves.
Yeah.
But again, with peptides,
It takes work.
And there's another side to the story.
Yeah.
For sure.
Yeah. Okay, well, let's finish this up. By the way, we really covered a lot of stuff here. Let's talk about just like what the future holds. One of my concerns is that because a lot of, listen, it's expensive to be on a whole group of peptides, but is it going to be worthy to the pharmaceutical giants to invest their money into these medications to create real research? Because we know that there are a lot of lost medications out there because it wasn't worth the money for them to do it.
I think some of them will get funding and have some research for sure. There's definitely going to start to be some, regulation. We're already seeing that California can't ship a peptide to, anywhere.
Oh, really?
So we're going to see that in the future. Also, I think that there's going to be really exciting progress in how we can apply the technology, and as forms of administration, and getting more data, As we have more technology, we'll be able to tie that in. We're doing things like continuous glucose monitor that people are wearing. When are we going to be able to?
I love that.
Yeah, it's amazing.
Really amazing.
So when are we going to be able to monitor cortisol levels on real time? When are we able to look at inflammation on real time? When are we being able to see maybe there's things that we could monitor growth hormone levels, that type of information that's going to be really being more than just every time you get your blood work.
What's amazing is that when we were kids, someone our age, I'm a little bit older than you, but someone our age, if they were 30 pounds overweight, didn't exercise, they can go to the doctor, get a set of blood work, stethoscope to the chest, a couple of things, and say, you're perfectly healthy.
You're fine.
But that person is a ticking time bomb for atherosclerosis, stroke, all these things. It's unbelievable. And now, I will say this, the future of monitoring, if you notice, I no longer wear my Oura Ring because the downside of that is that I got gamified and I got stressed out by the monitoring. I'm a very I turned my ADD into OCD and I had to stop wearing it for a while because it is just a pulse monitor of sorts, temperature and pulse monitor. And it does give an enormous amount of information. But if you're checking it like you do Instagram, the first thing you do when you get up in the morning, it could be a problem.
It could be negative. But I challenge, you would never go into a court case if you were an attorney and not have prepared a brief.
Of course.
Right? You're not going to go, to fix a car and not have your tools. Yeah. So when it comes to our health, this information is improving it.
I am all for it, but I do warn people that you want to be healthful, but there's also a mental state you have to have about it because you can't micromanage. You're not going to live forever. You can't micromanage everything, and you have to take a global picture. You also have to appreciate the health that you do have, take stock in that.
Yeah.
And I think there's a healthy way and an unhealthy way to do it. Again, I'm seeing online now all these young people. It's just like people who think they look old at 22. I think we have to be careful of the faddishness, and that's why they have doctors like you and doctors like me, and why we have the Pro Aging podcast. We've been talking about this for years, and now all of a sudden people are mad about it. That's one of the reasons why we partnered up, and I'm appreciative to have you here, my friend.
Thank you.
Tell the audience where they could find you, other than at ppfrankmd.
I share your offices.
Yeah, that's right. Oakwood Precision Medicine. Right?
Yeah, but I'm between the West Village and Upper East Side.
And what's your handle? What's your gram?
Oh, my Instagram handle at Dr. Jake Deutsch.
That's right.
And my TikTok.
And your TikTok.
I once went viral on TikTok. If you scroll, you can find out why.
Okay, yeah, we're going to do that right afterwards. Anyway, thank you so much for joining. I think it's like almost midnight. We've been talking all night.
Yeah.
Season 4, episode 1, we wrapped it up. The man right here, Dr. Jake Deutsch. Thanks, man. Appreciate it.
Pleasure.